In Los Angeles, California, a normal day for 13-year-old Emma Stewart includes tap dancing, playing piano, and hanging out with her friends.
You know, we just do stuff like paint each other's nails, watch TV. And we go to the Italian ice place down the street.
Now that summer has arrived, Emma is preparing for her first year of high school.
I'm going to be a freshman next year. I'm excited about that.
As she faces her freshman year, Emma dreads starting school for one reason: her lopsided nose.
It's crooked. When I turn my nose this way, there's more of a bump. And when I turn it this way, it's more straight.
During junior high school, Emma endured teasing from other classmates.
Like this one guy, he would say, "Oh, your nose, it makes you look like a man." It kind of hurts when someone says that to you, so you always kind of have it in the back of your mind.
I think that it has made her feel self-conscious about the way that her nose looks.
Emma's misshapen nose is a result of a deviated septum. The condition develops when the nasal cavity is blocked with cartilage. The buildup pushed Emma's nose to the far right.
Since it's crooked, I can't breathe very well out of one side of it. Hello?
She needs a septoplasty to repair the condition. The reconstructive procedure will open the airway and alleviate her breathing difficulties by removing excess cartilage and tissue.
Emma has suffered from allergies and asthma since she was a baby.
I think her whole health issue will be better if she gets more oxygen through her nose.
Emma also wants a rhinoplasty to reduce the bulk and straighten the tip.
I'm not asking for a little tiny nose, but I just want a nose that fits my face better and it's not crooked and I can breathe out of it and everything.
The same surgeon who operated on Nelson Castillo, Dr. Paul Nassif, will perform Emma's surgery.
So I think we're going to talk about your nose today, huh?
Yep.
Okay. What I want to do is give you a mirror. All right, so why don't you go ahead and point to me and tell me what you don't like about your nose.
There's a bump right there and then another bump right there, and I just kind of want it to be like smooth.
Any problems breathing?
Yeah, I can't really breathe out of the right side very well because of it's crooked.
All right, let me take a look inside your nose. There you go. Yeah, your nose is a little crooked. It's instead of being straight, it's deviated to the right. So let's talk about what we can do. You're about 5'3" or 5'4"?
Yeah.
So you probably have some growing to do still.
Yeah.
But you're not going to any growth spurts. So you're just at that age when we start thinking about doing a rhinoplasty. And what we'll do is we'll actually take care of these issues and take care of the inside of the nose, the septoplasty, which means basically taking the cartilage and bone that's pushed over, removing it, getting your septum back in the middle, and putting some of that cartilage back in your nose. That's the septoplasty. The rhinoplasty would be the cosmetic part, you know, getting this in and working on your tip.
The next morning, Emma's focus extends far beyond her surgery.
I'm hungry. I'm more than nervous.
Are you ready?
Yeah.
Yeah.
The biggest challenge with Emma's nose is trying to achieve that smoother oblique look, and also her bones are very, very wide. And so we're going to probably have to break each bone in two places called double osteotomies. And hopefully after we do the septum, her nose will be straight.
Dr. Nassif begins with the septoplasty to clear Emma's nasal airway.
Her cartilage is very flimsy, and her septum is very soft because it's still very young.
When performing plastic surgery on a young patient, the surgeon must be mindful of the fact that she's still growing. The operation could in fact alter the pattern of growth because the patient is not skeletally mature. While it usually benefits younger patients to wait until they've reached maturity, other concerns, such as Emma's blocked nasal passages, necessitate the procedure. Take-home message: the decision for early surgery is best left up to patients, their parents, and the doctor.
Dr. Nassif uses a scalpel to separate the bone and cartilage from the surrounding tissue.
If you overdo a nose and take too much cartilage, you'll get a pinch look. Plus, I won't be able to breathe. Gently. Go. through.
A surgical chisel breaks the nasal bone so Dr. Nassif can realign the passage.
So this right here is some of the bone on the floor of the septum which was pushed over in the left airway. And just by removing that, that's going to help her breathe in quite a bit.
He measures the cartilage inside Emma's nose to identify the exact amount to extract.
Leaving 7 millimeters of cartilage will keep the nasal tip very stable for a long time.
Satisfied with the symmetry of Emma's nose,
besides being a little swollen, it looks pretty darn straight to me.
Dr. Nassif performs the final procedure, a rhinoplasty.
This is a rasp, and that's going to remove some of the little knuckles on the side of her nose here.
He takes tissue from the end of the nose to reduce the bulbous tip.
And we're going to lay the skin back down very gently.
The doctor shaves down the hump to give Emma's nose a more balanced appearance. Dr. Nassif closes with interior and exterior sutures to her nose.
So everything went absolutely perfect, and I think she'll be very happy with this.
It's all right. I know your throat's tough.
Coming up, will Emma be bowled over by her results?
I want to have the self-confidence that other girls my age do. I definitely think it's going to help my self-esteem because if my nose looks better, then I'll feel better.
A month ago, 13-year-old Emma Stewart had a rhinoplasty to straighten her nose and a septoplasty to improve her breathing.
When I was in grade school, I used to get teased a lot about it.
Now she's got a nose that she loves and more than enough confidence to spare.
I feel really good. It's straight, you know. It's not like different when you look at it this way and this way. I can really feel the difference because before, you know, I'd touch my nose like that and it would just be like this like bump right there. And now I feel it and it's just like smooth and I'm like, yay. And I can breathe better. Now that it's straight, air can get through, and it's like, the first time I went back and he took the packing out, it was like, air.
I think Emma's nose looks fantastic, and I think she looks beautiful.
I was scared that people would be able to tell that I had work done on my nose, but if I don't tell anybody, nobody says anything about it. They just say, oh, you look good, you know? Like, not, what did you do? My friends say it looks really good. They're like, oh, you know, you look really pretty, and it's so straight and perfect. You have the perfect nose now.
Oh yeah. Since Emma had the surgery, I think her confidence level will just be boosted. In fact, she just went to have her school picture taken, and this time she didn't have to worry about, do I have my good side or my bad side?
It's good to get it done before high school so I don't have to miss any school, and, you know, if people that I meet in high school see me, then they don't have to know I even did anything. It makes me feel really good because now it's just like I don't have to worry about anything. I just feel like I'm happy with it.